Good evening again, everyone. Thank you so much for joining us again in the series of webinar of Philippine College of Lifestyle Medicine. Tonight, I'd like to say that this is a special webinar that we are doing, and this is intended for primary care physicians and specifically family medicine physicians. So this is in connection with the recent release of the supplement to the Journal of Family Practice. And this is a collaborative effort of the American Academy of Family Physician and the American College of Lifestyle Medicine. And the paper is entitled The Family Physician's Introduction to Lifestyle Medicine. I'm so excited because I'm into family medicine practice as well. So we've been looking forward to this paper several years prior to the release. And indeed, this is already out. As you would observe, we are actually encouraging more family medicine physicians and primary healthcare providers to join lifestyle medicine movement and to learn more about lifestyle medicine and eventually get certified into lifestyle medicine so that they can integrate this into their practice. And now we have this very, very nice, and I should say it's really introductory to what lifestyle medicine is all about, a material over 100-page that we can provide you. We'll be providing the link in our Facebook page, especially to those who joined us today. In fact, if you are following the page of the American College of Lifestyle Medicine, you'll be able to see the link there. But if you're not following them yet, then we can provide the link to you so that you can access them. And when you have time, you can read on them. This evening we'll be discussing on what lifestyle medicine is all about. This is kind of a information session to those who are not familiar to what lifestyle medicine is. If you've heard lifestyle medicine the first time, then this is the best time, for you to join the webinar and maybe to share this live webinar to whoever you think is interested into joining lifestyle medicine, or you think who needs lifestyle medicine to be integrated in their practice. We always say that lifestyle medicine is creating a market differentiation in your clinical practice because, like, for example, if you're a family medicine physician or you're an internist or you're a cardiologist, endocrinologist, or whatever specialization you may have, when you have certification in lifestyle medicine, when you get trained into this specialty, you have a difference in the market in terms of provision of the services you give your patients. So that means you're leveling up provision of services. And then, of course, in terms of clinical outcome for our patients, it'll be so much different, when you integrate lifestyle medicine in the practice. And we'll be learning more about that as we go along in this discussion. But before we go further, I'd like to thank the events committee for facilitating this webinar and our volunteers who are really doing their best and spending their time, for us to be able to bring you and put out informations like this, and so that you will learn more about lifestyle medicine. Now, this webinar is intended for physicians, but if you're not a physician and you're an allied health care professional, or even if you're a patient, it's really nice to know that doctors, can go into this kind of medical education, and so you'll know where to go to. Okay. Let me just share my screen. All right. So here's the paper that was published at the Journal of Family Practice. This is really exciting because we're really looking forward to having accreditation with the Philippine Academy of Family Physicians as we provide fellowship training in lifestyle medicine eventually for family physicians. So that's the goal for 2022 onwards, that we will be able to establish and begin the fellowship training in our pilot hospitals, training hospitals. Here, as you can see, this has been the effort of the American College of Lifestyle Medicine and the American Academy of Family Physicians, with the help of the Ardmore Health Institute, of course, and they were able to put out this material. So this material is over 100 pages of articles that you can look at and you can review. Of course, the comprehensive sources are also available when you get into lifestyle medicine education. But this supplement can already provide you very good information as you want to integrate and start, integrating lifestyle intervention in your clinical practice. So here, as you can see, and we know this, that the underlying health conditions reported by the CDC, or the Center for Disease Control and Prevention, which actually heighten the vulnerability of COVID infection, are to the large extent lifestyle related and directly impacted by social determinants of health. And this, too often prevent health choices from being the easy choice. So these unhealthy lifestyle behaviors are increasingly affecting healthcare expenditure. And you can see that it's not only affecting developed countries, but it has affected the Philippines as well. Now, as you can see in this paper from the UNDP, the Department of Health, and the World Health Organization, we can see here that if we implement the lifestyle package as intervention in primary healthcare, if we train healthcare providers, physicians, and allied healthcare providers into this lifestyle packages and lifestyle intervention, we will be able to save many lives, and we'll be able to save to as much as 4.8 of our GDP, which is the burden of chronic disease in the Philippines. Now, in looking at this statistics and looking at what's happening now in this global pandemic, this has made the presence of lifestyle medicine more relevant and more urgently needed than ever. Now, lifestyle medicine is defined, for those who are new to lifestyle medicine, this is defined by the American College of Lifestyle Medicine as the use of evidence-based lifestyle therapeutic intervention, which includes a whole food, plant predominant eating pattern, regular physical activity, restorative sleep, stress management, avoidance of risky substances, and positive social connections. So these are the 6 pillars of lifestyle medicine, which is a primary modality delivered by clinicians that are trained to implement these modalities in prevention, treatment, and often reversal of disease. Now, it is actually the vision of the Lifestyle Medicine Global Alliance to have lifestyle medicine as the foundation of all healthcare that can be fully integrated into primary healthcare and family medicine practice. Although lifestyle medicine is regarded as a new and emerging field, we can trace back history that the components of lifestyle medicine was actually first documented over 2,000 years ago. So you can see that Hippocrates, the Greek physician, the father of medicine, he used lifestyle modification like diet and physical activity or exercise to treat disease. Today, over 70% of Filipinos are affected with one or two or more of the top killer diseases that are thought to be more genetically inclined and that it cannot be modified at all. In fact, too many physicians and patients also believe that they are victims of these genes, that they are destined to become chronically ill eventually. But evidence show that heart disease begins in childhood, and it's killing about 200 Filipinos every single day. It is also alarming that type 2 diabetes can no longer be referred as adult onset diabetes because we can see that children are now diagnosed with the same lifestyle-related chronic condition. Although we know that early detection of chronic disease has often been defined as prevention or preventative, but despite this early detection, and campaigns, of screening the trends of obesity, type 2 diabetes, hypertension, cardiovascular disease continue their upward trajectory. Evidence indicates that modifiable behavioral risk factors drive the leading causes of this mortality. In fact, the Institute of Health Metrics and Evaluation, in its 2019 Global Burden of Disease report, they were able to analyze data from more than 190 countries, and they found out that what people eat and what they fail to eat is the leading cause of disease and death. So that's why addressing lifestyle is recommended as the first line of treatment option in many chronic disease guidelines. And you will see that over and over again, the newest guidelines right now for chronic diseases, for hypertension, for example, diabetes, heart disease, metabolic syndrome, dyslipidemia, you will see the emphasis of lifestyle intervention. However, looking at the surveys, physicians indicate having received little training, if there is at all, in clinical nutrition and lifestyle therapeutic modalities. That's why I am really, really sad whenever I hear physicians saying that regardless of how much lifestyle intervention you already provide the patient, nothing is happening. There could be a gap in terms of the provision of the intervention, the effectiveness on how behavior change was achieved in a specific case of this patient. So there's so much things to talk about in terms of lifestyle intervention. It's not just simply telling your patients to eat less fat, less oil, less meat, more on vegetables and fruits, and then you exercise and drink water and sleep well. So we cannot quantify how much intervention or how intensive you are providing your patient so that you'll be able to see the outcome. So it's just like a pill, any medication that we give, that whatever dose we provide, we are expecting specific results. So there is also a dose-response relationship in terms of providing lifestyle intervention. So this is where lifestyle medicine provides a promising change, which is underway. So we can see now the patient's demand is growing exponentially. Many patients are looking for physicians who can give them advices into lifestyle intervention. You will notice that more patients are now asking what they can eat, what they cannot eat, what they can do to improve their weight, for example, to improve their condition, for example, or they will be asking for advices so that they will not be adding more pills, or more medications. So instead, they will ask for whatever things they can do to improve their lifestyle. And of course, the healthcare providers' awareness is also growing about the need for the value of lifestyle medicine. Now, increasingly, there is also a recognition that medications and procedures have been insufficient to significantly alter the negative trajectory of our collective and overall health outcomes. Basically, lifestyle diseases are not very responsive to medications because they are lifestyle related. So regardless of how much dose we provide our patient, even if they are really compliant with the medications we prescribe them, if they are not removing the cause of the problem, eventually what's going to happen is just progression of disease. After several years, you'll see your diabetic patients is taking 4 pills now. Your diabetic patients now has hypertension, complications with cardiovascular disease, so on and so forth. So that's not the goal of lifestyle medicine. The goal is to look at the cause and to implement upstream method. We wanted to know what the patient is going through. Why is there such a problem in terms of behavioral changes, so on and so forth. And this is awakening the medical community and generating interest in the field of lifestyle medicine. I'd like to introduce to you the Lifestyle Medicine Global Alliance, and under this are affiliated lifestyle medicine societies across the globe. We have a unanimous goal to educate, equip, and empower all healthcare providers, specifically primary care providers and family medicine physicians, to identify and facilitate the eradication of the root causes of these chronic diseases, with health restoration and whole person health as the clinical outcome goal. So this should be followed when necessary, of course, by disease management with the ultimate aim of medication de-escalation when found necessary, and of course, halting the disease progression. Having that said, the imperative should be to help fill the void of lifestyle medicine in medical education through the offering of resources across the education continuum. So organizations like the American Academy of Family Physicians and the American College of Lifestyle Medicine have taken steps proactively to meet this demand. With the American Academy of Family Physicians' recent release, this is a new supplement resource entitled Incorporating Lifestyle Medicine into Daily Practice, and the American College of Lifestyle Medicine's offering of lifestyle medicine resources that you can actually see in their website. Are great resources for physicians to use in their clinical practice. Now, these resources, coupled with opportunity for certification through the affiliated lifestyle medicine societies globally, are actually helping to fuel the field of lifestyle medicine's rapid growth. Now, while lifestyle medicine is not new, large-scale implementation of this evidence-based modalities into health system is actually one of the greatest pioneering initiatives in the healthcare industry today. Now, lifestyle medicine represents a physician-led, interdisciplinary, team-based model, often leveraging shared medical appointments, or we call this SMAs. And this is delivered either in person or virtually to effectively treat groups of patients with chronic conditions. So remember, you will never be able to bring out this same counseling skill every single time you see your patients. Like if you have a long queue of patients waiting for you, maybe you'll be able to provide good counseling skills, in the first 3-4 patients, but you will not be able to sustain that in the next 5th to your 20th patients. That's why we do this through group visit or shared medical appointment. So this is a scalable model that supports the necessary behavior change that is central to lifestyle medicine intervention, while also capitalizing on the shared sense of community that is facilitated by group participation. This is where we are successful in terms of follow-up and monitoring, because we have group support developed in shared medical appointment in every group of patients that we handle. Now, lifestyle medicine is deeply rooted in scientific evidence, and this is delivered through a variety of practice formats. So we practice privately, so it's private primary care practice, or direct primary care, or concierge medicine, or it could be hybrid, meaning could be concierge or family practice, or it is integrated into health system, or we also have the specialist care, because we have this category in lifestyle medicine who are called the intensivist, or they are the specialist in lifestyle medicine. So who are holding cases in cardiology, endocrinology, and oncology. So these are trained lifestyle medicine physicians who are implementing intensive therapeutic lifestyle change. So this is another degree of training in lifestyle medicine that a lifestyle medicine physician can take after getting the general certification in lifestyle medicine. And then, of course, we also have the community-based care. But currently, the challenge to the system-wide healthcare adoption of lifestyle medicine actually includes reimbursement models, the misaligned quality measures, the research gaps, the health disparities, and the challenges associated with an equal distribution of social determinants of health. Now, we know And we always emphasize that lifestyle medicine is synonymous with value-based care, which means shifting healthcare system from fee-for-service to value-based care, which will elevate the importance of eliminating the root causes of disease to the possible extent, rather than just settling with reactive medical practice, that we're doing, that goes with the routine of medicating and managing the symptoms one after the other. Now, again, lifestyle medicine is value-based care. Now, as with all lifestyle medicine treatment, the objective is to rein in cost while producing superior patient outcomes and patient satisfaction through sustained behavior change. Lifestyle medicine is also vital to achieving the quadruple aim, which is one, to enhance the patient's experience. Number two, improve population health. Number three, reduce cost. And of course, last is to improve the work life of healthcare providers. Lifestyle medicine actually reignites the passion for why most of us physicians went into medicine, because we wanted to become true healers. And this is a good potential antidote to the epidemic levels of provider burnout. Now, as physician practice of lifestyle medicine increases, research in the field has also expanded in recent years, and this is mostly within the American College of Lifestyle Medicine and its sister organizations, and of course, externally. Analysis of lifestyle medicine reminds us that effective care requires not simply calls to education, but resources where they are needed most. Of course, assessment of opportunity cost and the critical evaluation of the interventions we can provide. Now, understanding the environmental drivers of unhealthy behaviors requires primary care physicians to work more closely with the community and public health colleagues to develop neighborhood and regional approaches, particularly in disadvantaged area. And this is where we call lifestyle medicine as a collaborative team approach in terms of providing healthcare services in the community. We must collectively shift from a system of disease and disability care to one of true healthcare enabled by a lifestyle medicine first approach that strives to identify and eradicate the root cause with health restoration, whole person health as the clinical outcome goal. Now, in caring for chronically ill patients across all socioeconomic levels, family medicine physicians and other primary healthcare providers are on the front lines of addressing these devastating, costly diseases that impact the quality of life. Yet, we know that many clinicians are only familiar with the disease and symptom management through the medications and procedures we prescribe and we advise. Now, the urgent need to treat the root cause of lifestyle-related chronic disease led to the creation of this supplement released by the American Academy of Family Physicians. And I am privileged to cascade its content to family medicine physicians and primary healthcare providers here in the Philippines. The goal is to provide information on all aspects of lifestyle medicine. Now, I will quickly go through the introductory information on the definition of lifestyle medicine 6 pillars and how lifestyle medicine delivery is influenced by the key determinants of health, how lifestyle medicine is being used to prevent, treat, and sometimes reverse multiple types of chronic disease, and of course, a peek into the current practice of lifestyle medicine and what the future holds in education and policy. Now let's start off with nutrition. I'd like to read here the case provided in the article. At an annual visit, this is a case of a 58-year-old man with a history of class 3 obesity, hypertension, and prediabetes. He asked what diet changes he can make to help him lose weight and improve his other medical conditions. He reports trying many weight loss diets over the years, including low carbohydrate diet and various calorie restricted diets. So all resulted in modest short-term, but no long-term weight loss, and did little to improve his other medical concerns. So the question is, how will a primary care physician counsel him? How will a family medicine physician counsel this patient? Now, this patient's case represents a common clinical scenario faced by many primary care providers and family medicine physicians. One that medical school, residency, and other advanced medical training have generally not adequately prepared clinicians to address. Now, this patient's case represents a common clinical scenario faced by many primary care providers and many family medicine physicians. But this is one that medical school, residency, and other advanced medical training have generally not adequately prepared clinicians to address. Now, that's why the aim of the American Academy of Family Physicians and the American College of Lifestyle Medicine and all lifestyle medicine societies is to provide an information and tools to introduce a whole food, plant, predominant eating pattern, which is a diet consisting of predominantly or exclusively whole plant foods such as fruits, vegetables, whole grains, legumes, nuts, and seeds. And of course, it should be aligned with the major medical societies' dietary recommendations. And we wanted to illustrate a spectrum of dietary change along a continuum from highly processed foods to less processed plant foods. And we also want to review the current evidences that supports predominantly whole food plant-based dietary pattern for the prevention and treatment of cardiovascular disease, overweight, obesity, type 2 diabetes, as well as for cancer risk reduction. And of course, provide practical guidance on promoting healthful dietary changes in clinical practice. We recommend providers to use this framework as a starting place when counseling patients to take steps to moving along a spectrum toward adopting a predominantly whole food plant-based eating pattern. Now, in addition to counseling on dietary and other health behavior changes, it is important for physicians to also become role models of good health. Now, evidence show that patients perceive physicians who practice healthy lifestyles themselves as more credible and better able to motivate them to make healthy lifestyle choices than those who do not. It's really hard for patients to see a doctor advising and counseling on healthy lifestyle when they do not see their doctors doing it. Or worse is when they see that their doctors are doing the opposite way. So that's why here the role of a physician is really crucial. Now, adopting a whole food plant-based eating pattern and leading a healthy lifestyle, physicians will increase credibility and efficacy when it comes to counseling for behavioral lifestyle changes in their patients. Now here, this is physical activity. We know that 7 of the 10 most common chronic diseases are positively influenced by physical activity. Now, the CDC estimates that getting enough physical activity could actually prevent 13% of breast and colorectal cancer, 8% of diabetes, and 7% of heart disease, as well as 1 in 10 premature deaths. It has also been shown to aid the management or as an adjunct treatment for colorectal cancer, renal disease, sleep apnea, osteoarthritis, hypertension, cardiovascular disease, type 2 diabetes, and obesity. But despite this knowledge and despite these evidences, studies show that only 23% of adults meet both the aerobic and the muscle strengthening physical activity guidelines. Physicians, again, we have an important role in counseling and prescribing physical activity to our patients. Research has shown that physical activity promotion within primary care settings significantly increases physical activity levels in adults for up to 12 months. So that's how we can influence our patients. Now, physicians, again, who exercise regularly are more likely to counsel their patients about exercising. Now, although this lack of counseling is multifactorial, inadequate time and inadequate knowledge and, of course, experience regarding exercise are the most common cited barriers. That's why physicians are not even talking about physical activity. They don't understand terminologies used, when they prescribe exercise. Now, we should also take note, however, that while we physicians are ideally positioned to start the physical activity and exercise conversation with our patients, it is always helpful for many patients to have a qualified rehabilitation or exercise professional with whom they can also work to see or oversee their program and get more specific feedback. Okay, so next here is stress. Yes, so stress is one of the lifestyle medicine pillars. And we know that stress is unequivocally linked to poor health outcomes due to both its physiologic and behavioral effects, as detailed in the article that you can find in the supplement. So I hope that you'll find time to read on those. You will see there that accordingly, the provision of stress management techniques constitutes an integral component of leading lifestyle medicine intervention. In fact, the American College of Lifestyle Medicine considers stress management to be one of the 6 pillars of lifestyle medicine, along with healthful eating, physical activity, sleep, social connection, and the avoidance of risky substances, because mental health is as important as nutrition. Mental health is as important as physical activity, but eventually you'll see that all of these pillars are interconnected and they go hand in hand. Now, you may also notice, as you read on the articles provided in this supplement, again, that these pillars of lifestyle medicine are also evidence-based approaches for managing stress, which demonstrates their interconnectedness to maintain health and well-being. Okay. Now, next here is sleep. The perspective of sleep as preventive medicine is appreciated in its two-way impact. So first is poor sleep increases the risk of disease and illness. And on the other hand, disease and illness also disrupt sleep. So this often creates a vicious cycle in which the cumulative effect is increased, of course, morbidity and mortality. We know that modern medicine has developed treatments with a focus on pharmacology and intervention that have been helpful. But for family medicine physician and primary healthcare providers, the burden and the growth of sleep challenges will require reframing with a focus on prevention. We know that sleep disorders negatively impact both short and long-term health. The more immediate effects reduce a sense of well-being and performance. Now, the accumulated effects of disordered sleep, on the other hand, includes premature mortality, cardiovascular disease, hypertension, obesity, metabolic syndrome, diabetes, impaired glucose tolerance, immunosuppression, inflammation, cancer, cognitive impairment, and psychiatric disorders like anxiety and depression. And of course, we also include counseling on the use of risky substances. Busy physicians may find it challenging to spend an extra time in clinic visits providing psychoeducation. Additionally, if a physician is more comfortable with prescribing medications or patient is expecting a prescription, trying out a new approach can be uncomfortable, as one or both the patients and the doctor may be moving out of their comfort zones. Fortunately, extra time can be also billed. You can ask payment for it. So we instruct the patients to start mapping these habit loops, out in daily life while asking themselves the questions, what do I get from this? Additionally, with small amount of practice, the prescribers, healthcare physicians can quickly feel more comfortable exploring this approach. Of course, with the added benefit of increasing empathetic connection with patients. So, for example, mapping out a habit together shows a patient that a clinician hears and understands the concerns. And it also helps the clinician confirm an accurate understanding of the patient's experience. So that's how we do it when we do counseling in the use of risky substances. And lastly, among the 6 pillars of lifestyle medicine, we have positive social connection. We know that socially isolated patients experience poorer clinical outcomes, including increased hospitalization and higher medical costs. Social isolation significantly predicts a greater risk for chronic conditions like coronary heart disease, stroke, type 2 diabetes, and their susceptibility to viruses and upper respiratory illnesses. And in addition, there is evidence of the mechanisms by which social connection may influence morbidity and mortality, including psychological factors such as perceived stress and depression, behavioral factors such as sleep, physical activity, and smoking, and biological factors such as inflammation. They are also impacted with good social connection. Now, to simply put this out, one's social well-being can significantly influence chronic disease morbidity and mortality. However, few healthcare professionals discuss this with their patients. The acknowledgement of the health effects of social connection or social isolation within the medical community, establishing biopsychosocial or emotional approach to health is a potentially important step in addressing this gap. In fact, you will see in the heart disease reversal program of Dr. Dean Ornish, one of the principles utilized in the treatment is basically love, social support, So it is really crucial for patients to have good social support when they are embarking into a behavioral change. So that's why in family medicine, I'm sure you're familiar with family conference. So like, for example, if you wanted to have nutrition prescription for the patient, we can have family nutrition conference, for example, or family nutrition counseling, so that the family can support whatever new dietary pattern that the patient may start, or may begin, because it's hard to sustain specific behavior when you're alone doing this and the rest of the family are doing the other way around. So we needed support in here. Now, there are many different chronic conditions where lifestyle medicine is really providing a huge impact in terms of reversal or in terms of halting the progression of the disease. One of those is diabetes. So you will see evidences surfacing, right now that diabetes is highly reversible. And the goal of lifestyle intervention is to achieve remission the soonest possible. We can also see evidences that coronary artery disease or cardiovascular disease can actually be positively impacted by lifestyle changes. And we can see that there is possibility of reversal, specifically of the symptoms, in as early as 12 weeks. If you have attended the webinar last week, we discussed that lifestyle intervention, intensive therapeutic lifestyle intervention for cardiovascular disease decreases angina in as little as 12 weeks. So things that never happen can never happen in a medical practice if we only give the patient pills. So that's why you will see in the clinical practice guidelines, lifestyle intervention is highly emphasized. So in our last meeting, or webinar, we emphasized there that if we only provide medication to patients, the prevention for cardiovascular disease is as little as 20 to 30%. But if we provide lifestyle intervention, we can prevent over 90% of cardiovascular disease. So that's why you will see again in the guidelines the emphasis of lifestyle intervention along the spectrum of management of these chronic conditions. So from the beginning, from the onset of the symptom, and as maintenance intervention, we can see there that lifestyle intervention should be given, should be provided to patient, regardless, whether the patient needs medication or not. Now, lastly, I'd like to discuss about the future of lifestyle medicine education in the Philippines and how will it be integrated into medical education. Now, this is the resolution 959 released by the American Medical Association and with a collaboration with the American College of Preventive Medicine. This resolution advocates integration of lifestyle medicine into medical education. And this is undergraduate medical education. That means medical students will already have a full integration of lifestyle medicine curriculum from first year to clerkship. And then this is also integrated into postgraduate internship, and it is also integrated into residency programs. Now in the United States, lifestyle medicine is integrated in internal medicine training, family medicine training, so on and so forth. So in the Philippines, fortunately, we have one university that is now integrating full lifestyle medicine curriculum in medical education from first year to clerkship, and this is the Adventist University of the Philippines College of Medicine. We actually had the first batch of our graduates who already finished medical school, and they had the full curriculum in lifestyle medicine. Now we are in the process of integrating lifestyle medicine in residency training in family medicine. So that means residents who are into family medicine training, where lifestyle medicine is integrated, can graduate with 2 qualifications. So they can be qualified, of course, for the family medicine certification and lifestyle medicine certification as well. So we have pilot sites for this already. We have the Antique Medical Center, and we have the Bacolod Adventist Medical Center. Now, if you are attending now and you're interested to be included in the pilot sites where this training can be integrated, you can always search us out. And let's see how we can help you. If you're a training, if you are a training officer in your residency program in your hospital, please do approach us, because we might be able to help you integrate lifestyle medicine in your residency trainings. And like I said, now we are working on the requirements for fellowship training in lifestyle medicine, and this will be under family medicine. So that means diplomates in family medicine can go for fellowship training in lifestyle medicine. We cannot give you the details yet because this is a work in progress, but cross fingers, hopefully we can give updates into this year. And then looking forward to 2023 for its implementation. So we also have target sites where we can implement the first and the cohort for a fellowship training in lifestyle medicine. Now, if you are in internal medicine, endocrinology, cardiology, surgery, pediatrics, OBGYN, or whatever specialty, of practice, and you're interested to go for certification of lifestyle medicine, we have a certification program with a track directed to international affiliation as well. You can always reach us out if you're interested, so that we can walk you through on the steps needed for this certification. We highly recommend that you try to qualify for this year's certification, because the requisites are adding up every single year. So next year there'll be more requisites that will be implemented, and so this year we encourage you to somehow look at the requisites and see how you can work it out and qualify for this year. So again, lifestyle medicine education is new in the Philippines. We were able to brought the education system of lifestyle medicine only in 2018, but we are happy and we are glad that as of now, we have over 90, almost 100 certified lifestyle medicine physicians in the country, and we have 2 lifestyle medicine specialists in the Philippines. So we are looking forward to have more lifestyle medicine physicians joining the Philippine College of Lifestyle Medicine, coming from different fields of practice. So the certification in lifestyle medicine is open for primary care physicians, family medicine physicians, and any specialty if you wanted to practice lifestyle medicine in your clinic. Now, if you also wanted to integrate lifestyle medicine in your hospital services, like for example, if you wanted to establish a lifestyle center in your hospital, you can also reach us out. We can do consultancy, and we have the directory of lifestyle medicine physicians in the Philippines who can help you to put up the center so that you can offer the services in your hospital. So currently in the Philippines, we have the Antique Medical Center, we have the Adventist Medical Center, Bacolod in Manila. The Medical City also has a wellness and lifestyle medicine center, and other independent clinics, are also implementing lifestyle intervention in their own spaces. So again, if you are in a hospital-based practice, you can always integrate lifestyle medicine in your services. Now, I hope you'll find time to go through the material that we will be providing you, the full material, of this presentation. And I'm sure that it will be really helpful in your clinical practice. So if you have questions about lifestyle medicine education and how do you integrate this in your practice or in your residency training or in your medical education for medical schools, we are very much willing to accommodate your questions. Now, if you have any questions about lifestyle medicine education, you can always visit our website. You can select education and look at certification process or look at the courses offered there. And you will see several steps, that you need to take up so that you will qualify for the certification or for the training in lifestyle medicine. We also have our team in the education committee who can also help you with those requisites. So if you have some questions, I hope the facilitator will be able to accommodate them later. Again, thank you so much for joining the Philippine College of Lifestyle Medicine. I really hope that you will share this material in your Facebook pages and in your account so that many healthcare providers will be reached as well. So maraming salamat po and magandang gabi.